growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know. A Washington state resident fell ill after returning from Wuhan, China, where the outbreak began. Officials now say more than 400 people have been sickened and 9 people have died. The World Health Organization is holding an emergency meeting right now.
More than 100 families, that's 1,000 people, are under New York state mandated self-quarantine. The Young Israel Synagogue of New Rochelle and 3 schools connected to it, as well as Yeshiva University in Washington Heights, now all closed for sanitizing.
And that was only the beginning. With over 100 million cases worldwide and over 2 million deaths, how has the pandemic impacted us as Jewish leaders, and what does the future hold for synagogue life? Welcome to the thesis presentation of COVID-19 National Synagogue Survey of Ritual Activities and Programming. I'm Dr. Linda Bernstein. Join me as we explore the multifaceted impact of this hopefully once-in-a-lifetime pandemic to gain a better understanding of how it has shaped our lives as Jewish leaders and those of our congregants. We will characterize the emotional, programmatic, technical, and financial challenges we have had to overcome and how it has changed our responsibilities and practices. Finally, we'll have a chance to reflect on this painful year and where we may be headed in the new normal. We begin with an overview. The morbidity and mortality associated with COVID-19 worldwide has been profound. We are as yet to fully understand its long-term physical and mental effects. It has impacted not just our health, but almost every other aspect of our lives. The very nature of work and domestic life, from education to eating to travel to how we practice religion, have all been changed dramatically. The ways we engage in synagogue life, do family rituals, educate our youth, celebrate Shabbat, holidays, and life cycle events have undergone an almost dizzying transformation this past year. Our purpose was to conduct a national survey to determine the impact of the pandemic on synagogue ritual services and programming. The learnings will assist in current and future pandemic planning, examine best practices, allow a sharing of experiences, assess clergy roles and responsibilities, and help cantors and music directors to optimize the musical experience. This was an exploratory study with no specific hypothesis. We tested the utility of the survey instrument to measure the impact of the COVID-19 pandemic on synagogue life. The key areas of inquiry were background, religious services and programming before and during the pandemic challenges, assessment of virtual experience, and experiences and reflections. Epidemics in biblical times were often associated with divine punishment for sin, and God decided who would live or die. God said, "If you will heed the Lord your God, keeping all his laws, then I will not bring upon you any of the diseases that I brought upon the Egyptians, for I, the Lord, am your healer." It is clear that following God's commandments may have been the Israelites' best preventative against diseases and plagues. Biblical and later suggested, quote, cures and prophylactics against epidemics included Moses' brother Aaron burning incense and King David's directive to recite 100 blessings a day to squelch a divinely instigated plague. It was recommended to avoid walking in the middle of the road during an epidemic lest you encounter the angel of death. Then slowly, as awareness grew about the spreadability of infections, social distancing and other preventative measures were advised. Fears and uncertainty about epidemic origins can lead to distrust, as in the case of the 14th century Black Death, when Jews who were less affected were accused of causing it, resulting in forced confessions and mass killings. Their hygiene and isolation may have reduced their infection risk. The early rabbis got involved in infection control during epidemics. Rabbi Moses Isserles took his own advice to leave a city where there is an epidemic and don't depend upon miracles. He fled a Krakow epidemic in 1555. One rabbi wanted guards placed at the doors to limit the number of worshipers to 15. Another said, "Don't fast on Yom Kippur so you can keep up your strength." This 1918 headline looks like it could be from today. Public health, Jewish denominational, professional clergy, and other organizations have offered guidance on the pandemic for faith-based and specifically Jewish organizations, synagogues, and schools. These guidelines range from how to conduct safe burials and shiva, community outreach, and prayer services. Feature articles and research paint a picture of COVID impact on Jewish life. There is overall satisfaction with online services, though they are considered more impersonal, with diminishing numbers of synagogue members watching, but more non-members. There is a need to connect with the vulnerable, as many are feeling isolated and under financial strain. More programming does not lead to greater satisfaction. Leaders need to customize and adapt to virtual services and life cycle events. This was a June 2020 National Electronic Survey of Synagogues. There were 52 questions, mostly objective in nature and some open-ended. The survey was divided into 7 sections. We surveyed 3 cohorts: Academy for Jewish Religion California, Cantor's Assembly Listserv, and synagogue partners of the Jewish Community Federation and Endowment Fund in the San Francisco Bay Area. There were a total of 99 respondents, representing a 9.8% response rate. Sixteen states were represented in the survey. 65% of respondents were from California. 70% of respondents to this question were affiliated with AGRCA, almost half were members of the Cantor's Assembly, and a small percentage were members of the Rabbinical Assembly. Almost 60% of respondents were cantors, soloists, musical directors, rabbis, or spiritual leaders. The remainder were a mix of professional staff and lay leaders. 44% of synagogues were conservative, 31% reform, and the remainder was a mix of other denominations. Synagogues were evenly divided between small, medium, and large congregation sizes. Almost all synagogues were closed during the pandemic, most starting in March of 2020, and most have not reopened. Pre-pandemic High Holy Day, Kabbalat Shabbat, Shalosh Regalim, Passover, Shavuot, and Sukkot, minor holidays, and Shabbat morning services were offered most frequently, but only 27% broadcast virtually. Adult education, religious school, sick visitation, cultural and women's groups were most common, but only provided 4% of the time as virtual programming. Synagogue attendance pre-pandemic, as one would expect, varied according to the service, with under 20 attendees on average for daily minyan, if they even had one, to High Holy Days, where almost 2/3 of synagogues had more than 500 attendees. Musical enhancements pre-pandemic were used in 2/3 of respondent synagogues for Kabbalat Shabbat. About half used them for High Holy Days, minor holidays, and family services. A third used them for Shabbat morning, Havdalah, and Shalosh Regalim. Guitar was the main instrument used, followed by piano and choir. The top pre-pandemic rabbinical roles were conducts life cycle events, pastoral care, delivers sermon, adult education, and service leader. Cantors, soloists, and musical directors functioned as service and song leader, followed by conducts life cycle events, youth education, pastoral care, reading Torah, and adult education. Overall, most respondents indicated their congregants were very satisfied with synagogue pre-pandemic religious services and programming. Satisfaction was assessed by word of mouth, based upon attendance, periodic surveys, and board feedback. "86% of respondent synagogues conducted religious services during the pandemic. Virtual Kabbalat Shabbat, Shabbat morning, Havdalah, family services, and community Seder were most frequently offered. When not virtual, some restrictions were instituted, such as having them outdoors, requiring an RSVP, limiting numbers, and no children under 12 allowed. About half of respondents indicated that attendance at virtual services during the pandemic exceeded that of non-pandemic services. The rest noted that attendance was about the same, less, variable, or tapering down over time. Almost 2/3 of respondents have used musical enhancements for virtual religious services during the pandemic. Some used pre-recorded music but missed communal singing. Respondents emphasized the need to have a good sound system, computer and internet connection, use only one instrument at a time, make sure everyone is muted on the call and do not sing out loud together, and use the original sound setting on Zoom. When asked about the virtual responsibilities of their clergy during the pandemic, almost three-quarters of respondents indicated that their rabbi served as a service leader and delivered sermons, and also provided pastoral care, including visiting the sick and adult education. Half of respondents indicated that their cantor, soloists, and musical director served as a service leader, song leader, and provided youth education, conducted life cycle events, pastoral care, including phone calls to the sick, and adult education. 17% of respondents did not have a cantor, soloist, or music director. Program offerings done virtually during the pandemic were similar to those offered before the pandemic, but indicated by fewer respondents. They included adult education, religious school, sick visitation, cultural programs, women's group, and meditation. Two-thirds of respondents indicated they had to conduct life cycle events virtually during the pandemic. A similar number combined indicated the events had to be either canceled or postponed. Almost 40% indicated they had to limit the number of participants. A little more than half of respondents reported they were able to handle meeting the spiritual challenges of their congregation during the pandemic. A quarter of respondents expressed feeling overwhelmed. A fifth of respondents were mainly focusing their spiritual care efforts on those with greatest needs. Almost half of respondents said they were personally coping fairly well with the emotional stresses of clergy life during the pandemic. About a quarter indicated they were coping extremely well or very well. Only 4% said they were not coping well. Three-quarters of respondents indicated their synagogues have set up a special committee or task force to deal with the various aspects of the pandemic. 16% have not. Some said issues were handled and discussed by their board, a pre-existing emergency committee, or by a core group. The survey was distributed in early summer, so synagogue High Holy Day plans were still in flux. Two-thirds of respondents said they were planning on having virtual High Holy Day services in real time. A third will pre-record all or parts of the service for later playback. About a quarter of respondents will do live services in the usual or an alternative space. Among the other responses were, "I'm retiring and I'll leave it up to the next rabbi." Several respondents were still figuring it out. Three-quarters of respondents said that their congregants felt isolated and longed for community. Half of respondents said congregants are scared to come back even if social distancing is enforced. Some indicated congregants felt confusion, anger, wanting to return with safety measures, and appreciation of Zoom and breakout rooms, especially for members who could not come to shul. Almost all respondents used Zoom as their video conferencing application during the pandemic. About half of respondents used Facebook Live. The third most used application was StreamSpot. FaceTime was used for B'nai Mitzvah lessons. About half of respondents indicated congregants were very satisfied with virtual religious services and other programming, and about a third were somewhat satisfied. Some said, "The rabbis do a great job, but we miss the social aspects of seeing each other and making Kiddush together." Or, "Not sure, but grateful," and "Those who attend are satisfied, but the others do not attend." Three-quarters of respondents use word of mouth or informal feedback as a mechanism to assess congregant satisfaction with their virtual religious services and programs. Two-thirds use attendance. Others use periodic surveys, YouTube views, and calls to congregants. Half of respondents indicated that they want or plan to continue offering virtual services and other programming after the pandemic is over and their synagogue reopens. About 20% said either maybe or unknown in answer to this question. The top hopes regarding continuation of virtual services and programs once synagogues reopen are that it will allow participation for those who cannot attend while maximizing safety. They felt halakhic principles could be adapted. The top fears expressed by respondents were that continuation goes against halakhic principles. It will discourage in-person attendance, lead to loss of existing members with non-members having access without paying dues, and threaten the quality of youth education. The greatest benefits identified by respondents to conducting virtual services and programs during the pandemic were that congregants were very grateful and relished seeing friends and family online. It enhanced congregational community and spiritual comfort in the face of the crisis, attracted those who did not normally come to synagogue, and illustrated versatility, flexibility, and creativity of clergy. It also encouraged family and elderly participation and was easy for most to grasp technology. The greatest obstacles to conducting virtual religious services and programs were sound and connectivity problems. Others said congregants were uncomfortable, unhappy, or burned out. Technology know-how was an obstacle for some, but improved over time. Other issues included not being able to sing together, and the cost of providing a quality production was prohibitive for some. It was recommended to have a shorter, more focused service and keep it interactive. Respondents were asked to share their experiences, learnings, and best practices regarding services, programs, and spiritual care. They emphasized to ensure to keep the community together and do your best to meet their needs. This can be done by a caring committee within the synagogue, clergy, board, and volunteer outreach. Aside from various technological and production issues, balancing accessibility, interactivity, and security has been an issue for some. Clergy burnout can be worse than congregant burnout. When asked what they would do or not do differently next time, some felt they had done everything they could. People seemed to be happy and will continue doing what they're doing. Others said they would add more musical or other elements to increase interest in services, add both Friday night and Saturday morning services, call more congregants, equip the elderly so they can connect to the internet, and most importantly, make congregants feel we are still there for them. Let's review. What did the survey tell us? An almost complete shutdown of in-person synagogue services and programming started in March of 2020 due to the pandemic. Virtual Kabbalat Shabbat and to a lesser extent Shabbat morning services predominated. Virtual life cycle events had to be customized, but also many postponed or canceled. Half said service attendance went up, and others said it was variable or tapered over time. Musical enhancements continued during virtual services, but also adding in pre-recorded music. Rabbinical roles shifted to fewer life cycle events and more service leader, pastoral care, and adult education roles. Cantorial roles stayed about the same. Congregant satisfaction went down during the pandemic, as assessed primarily by word of mouth. Regarding pandemic challenges, half of clergy indicated that they were meeting spiritual needs of the congregation, while a quarter felt overwhelmed. There was a need to prioritize. Half of clergy were coping fairly well, while a quarter were coping extremely to very well. Support was provided by special committees. Congregants are feeling isolated and long for community. Others are afraid to return, even if socially distanced. Half are in favor of continuing virtual offerings post-pandemic, but many pros and cons were expressed. The pros of virtual services and programming ranged from drawing in those who normally would not participate to providing a safe source of spiritual comfort. The cons included virtual burnout, loss of paying dues, and technical issues. Respondents shared best practices. There was a need to quickly adapt technology, services, and programs to ensure safety. Use all methods to reach out to sick, elderly, and congregants with low technology skills. Increase variety, frequency, interest level of ritual services and programs, and allow time for just socializing. Financial challenges exist due to decreased dues income and the need to beef up production quality. There are many questions we need to ask. For example, is this the new normal? How can we do ongoing assessments of congregant needs? How will these changes alter the training of new clergy? Will there be a survival of the fittest in terms of service and program offerings? Are we overloading congregants with the mediocre and not homing in on what is most compelling? Will our halakhic organizational bodies continue to adapt to meet the needs of our communities? Study limitations included its relatively small sample size and lack of diversity in the respondents. Long-term follow-up of the pandemic and adaptations to it will be the focus of future research. Are we on the right track, and can we do better? Finally, we have two brief updates. Rabbi Joshua Davidson, Senior Rabbi of Congregation Emmanuel of New York, asked his congregants, "How have these last 10 months shaped your Jewish identity and experience?" Their responses were illuminating. Some expressed a renewed love of Judaism, a reconnection to faith, and a greater appreciation for taking time out for Shabbat. They enjoyed easier access to ritual and other offerings, and found less of a barrier for new members to feel welcome. They were excited about the ability to reach out to Jews everywhere, but at the same time realized that offering top production quality virtual programming to congregants is expensive and may leave out the have-not smaller congregations. They hope online learning will continue as a way of boosting American Jewish literacy. Will congregations be able to resume in-person services and programming anytime soon? The United States Supreme Court ruled on February 5, 2021, that California can no longer continue with a ban on indoor church services established to reduce the spread of the coronavirus. For now, the state can continue to restrict singing and chanting inside, but cannot bar in-person services completely, though it can restrict attendance to 25% of capacity. In conclusion, we should be proud of our ingenuity that has allowed us to continue our religious practices and reach out to our community and beyond. Let us hope that by next year, we will again be able to celebrate our Torah together, bless our grandchildren in person, and provide comfort to the mourner. The Jewish people have survived worse calamities, and this too, we hope, shall pass soon. That said, clergy and leaders of our synagogue communities have a special role to play in providing support and comfort to those who need it and finding all means possible to keep the faith in these difficult times among congregants and the wider world. L'chaim.